Good morning. Hope your day is off to a terrific start on this Tuesday. Lots of you waking up very happy that the Georgia Bulldogs took that championship title last night. I'm going to raise my hand among them as a proud UGA grad. For you Alabama fans out there, well, you've had plenty of great wins over the course of your seasons, and it was a terrific game to watch for both teams. So I think that both sets of fans should be proud. But as we begin our show this morning, I'm not your sports person, but I'm definitely always happy to bring interviews your way that will enrich your lives. A great time for us to have Dr. Chelsea Ryan kick off the show. She is with CHI Memorial Integrative Medicine Associates, and this morning she's focusing on cervical cancer screenings because this is Cervical Cancer Awareness Month. Good to see you.
Good to see you. I like the kickoff segue, sports reference. That worked really well.
Hey, listen,
it was good to see you.
It's been a long time since I was up until midnight watching anything, much less a football game, but that was a fun game to watch as a Georgia grad.
I was in bed at 9:30, but I did wake up and read the highlights.
Yes, you watched the highlight reel. That's right. So let's talk a little bit about the focus on cervical cancer, because I think a lot of women might be thinking, okay, it's great to have that awareness month, but isn't a cervical cancer diagnosis a very dire thing? Have we reached a point in medicine where if you get that diagnosis, there's actually some positive steps you can take?
Yeah, for sure. And, there are procedures that can be done after that. And, when you are diagnosed with a cancer, as with any cancer, especially, and cervical cancer included, there is different staging and then processes for that. So the biggest thing that you can help to do to reduce that risk is, doing adequate screening. And so we're going to talk about that today and kind of when you start doing it and other risk, things that you can do to reduce your risk.
Okay, so let's start with the screenings then. When should you begin?
So for cervical cancer screening, we do something called the Pap smear, and a lot of people have heard or are aware of that, but for those who aren't, it's basically when a speculum is inserted and the doctor will look, or the nurse practitioner, or whoever your healthcare provider will look at the cervix of the female. A small rubber brush will be taken and swipe some cells and then sent to pathology where they're looked under the microscope. This screening, despite sexual activity or not, is started at 21 for the asymptomatic person. So we started doing those at 21. Before 21, the risk of cervical cancer development is quite low. So, if you have symptoms, though, never disregard them. Speak to a gynecologist or a primary care doctor and get squared away with that. So, number one, starting at 21, and that is done every 3 years. And then once you turn 30, let's see here, because I always have to write these down. When you turn 30, you do a Pap smear plus testing for HPV. So cervical, and this is a good segue here, cervical cancer is caused by the human papillomavirus. There's some more high-risk viruses that will cause that. So every 5 years, we can test with HPV for that subgroup between 30 to 65. Depending on, it's really a person-to-person basis. So depending on your history of Pap smears and things like that, or sometimes even, preference for the provider, they may decrease that interval in between or whatnot. So, and part of the Pap smear, there's actually two parts. So we look at the cells, or a pathologist, not me, a pathologist looks at the cells under a microscope and can tell, these cells look kind of different. We recommend further evaluation versus follow-up, things like that. So that's one part of the Pap smear. And then the second part is testing for HPV, so that virus that causes cervical cancer we will test for, and that's will also kind of change the interval of your Pap smears. And then lastly, so over 65, you have won the prize. You get to start talking to your doctor about whether you're going to continue your Paps or not. And so that, again, is a very individualized decision between the patient and the provider, depending on your history of Pap smears. Were you adequately screened? Did you have normal Pap smears? And so, some people end up talking to their doctor and say, hey, I would like to continue those. And that's just a shared decision-making conversation. And then last but not least, if you've had a hysterectomy, so removal of the uterus, you get to also talk to your your primary care provider or gynecologist about how you're going to go through with screening. And it just depends on why you had your hysterectomy, which parts were removed. Was the cervix removed, or is it still intact? And then you just kind of have that shared, like I said, shared decision making between you and your provider.
Okay, so I know that you and I are both going to tap dance a little bit. You're younger than I am, but I still get uneasy with conversations like this. You're trying to be very careful as well. So this is kind of an adult topic, I guess, that we're having this morning. But parents, any parent out there who has a child probably even as young as 8 and then certainly older, has begun to have conversations among friends or with their pediatrician about this HPV vaccine. A lot of folks feel comfortable with it. A lot of parents say, no, that one's not for me. It is not a requirement, but it is recommended. Is that right?
Yes. Yes. So let's take a step and look at that. So the recommended age to start the HPV vaccine is actually 11 to 12 years old. And then you can get that all the way up to age 26. So the idea of the HPV vaccine is to help to reduce the development of cervical cancers from the HPV. Okay, so the idea is that if we vaccinate young, both boys and girls, because the HPV is carried between sexual partners, man or female, and so the idea is that if we vaccinate young, we hope to decrease that risk of cervical cancer being transmitted back and forth. And so when I sit down with a parent to have this conversation, I am very understanding that as a mother, as a parent, but even those who aren't parents, know that this is a touchy subject. And so what I try to do is just approach it as this is not a vaccine that is going to say you can now start having unprotected sex. So I try to approach it eventually, possibly your child will grow up or will at some point decide to have sex. And with that, we want to make it the safest possible experience for them ever. And this vaccine will hopefully help decrease that risk. And so if multiple people or children are vaccinated, when they decide to make that decision or talk to their parents and have that decision to ultimately have sex, that they will decrease their risk of having cervical cancer or passing HPV back and forth. But we still also always talk about safe sex practices, condom use, things like that.
Okay, I'm almost going to have to wrap it up, but real quickly, out of curiosity, when you say it decreases the risk, do you know by how much?
I don't, but I will tell you about my experience with the vaccine. It came out when I was in college, and I got that at the very end. And I'm just very thankful that I did, because although vaccines won't, ever give you 100%, right? There's always risks out there. It does help give you peace of mind for the future.
You have definitely educated us this morning, and I hope that when the camera's turned off, you'll go, phew, because it's one thing to have this conversation with your patients in the office. I know it's entirely different when you're trying to make it make sense to a viewing audience on television. So you get an A for doing that for us this morning.
Yes, I mean, difficult conversations are typically the most important.
Oh, very, very well said. You can find Dr. Chelsea Ryan, though, in her practice up on Signal Mountain, as I mentioned, on Taft Highway, 886-2004. She is a general practitioner, which means that she can help everyone in your family, and that's a great gift to have, because these conversations happen over time and with trust with your physician, and that's what she hopes to foster, not just with you, but everyone in your family. CHImemorialmedicalgroup.org is the website.